welcome to another CBD Talks with Dr. Dance. But really, my name is Dr. Victoria Boyd, and I'm here to bring you information and other details about CBD in the hemp and cannabis world. You know, last time we talked about the endocannabinoid system, ECS as some people call it. But I think I need to touch base on that a little bit more because that is one of the key points that most people are confused about. Endocannabinoid system. You know, it's called the gatekeeper of all of your organs. And it's really important because it's in every cell in almost every living being. Dogs, cats, animals, humans can be detected to have that endocannabinoid system or those receptors. Currently, there are two key receptors, CB1 and CB2, and they're found in every part of the body. This diagram shows how they're really prevalent in the brain and neural pathways. They're also in your gut, in your organs, but they're found throughout even your skin and dermatitis and that which is a big organ. Through your bloodstream, you can see that you can pick up and they can have an impact on all of those systems. And that is why CBD, endocannabinoids, the chemical profiles that are found in the plant, the miracle plants, hemp and cannabis, can help your endocannabinoid system. Now, I got a question through one of my sites, and it was asking me, so what does it really help? Now, technically, I can't talk about diseases, but I will talk about how it helps from head to toe. So let's talk about your neuro system. What does that control? Okay, it controls different neurodegenerative types of diseases where the muscles might fail, or different receptors, your peripheral systems, your legs, your muscles, your different systems of passing and getting your, see, I'm trying to describe it without using diseases names, and that becomes hard, but any type of disease where your muscle structure might be broken down, it can help because the CB2 and the CB1 receptors are in those cells. CBD oil helps renew, revive, and regenerate. And let me repeat that. Renew, revive, and regenerate. Renew means that it can help boost its effectiveness, make it work better. Regenerate means it can repair. It can almost bring back the cells to its original state. As we age, those cells break down. But to renew and regenerate them means that we're bringing them back so they might be functioning 100% again. So what does that mean for us? I was taking 8 to 10 ibuprofen a day for pain. So it can help me cut down on pains. But when we're talking about specific things throughout the body, let's say we're dealing with our immune system, which helps protect us from other diseases. So if we are building up, renewing, rejuvenating our immune system, it will protect us from some of those serious diseases that are out there in the world. You can just imagine one that is killing people day after day, that it's called the Big C. So it will help alleviate, and you can benefit and gain some of the valuable assets that CBD, cannabinol, which as it's identified through its chemical profile, can help. Now, CBD, as I mentioned, is the acronym for many. And I have a sheet here. Let me just name off a few. We have CBDA, and that reduces inflammation. CBG, aids in sleep, promotes bone growth. CBGA, again, reduces inflammation but relieves pain, and many people are in pain. It slows bacterial growth, and many diseases are caused by bacteria. How about CBC? It inhibits cell growth of the big C. It promotes bone growth also and reduces inflammation. And the reason many of these, I say, reduces inflammation, did you know that almost 90% of all diseases are caused by inflammation? They trigger the disease to actually go bigger or become more prominent in your body. Let's talk about CBCA. Fungal infections. Have you ever had one of those? How about the skin condition where it makes it feel leathery? CBD can help relieve that. I have a person I know personally who had it on her eye, and guess what? It's clearing up as we speak. Then we have Delta-9 THCA. It aids in sleep and suppresses muscle spasms. I suffered from muscle spasms in my leg. Many people call it restless leg syndrome or other different types of conditions. It actually has a medical term, but it causes spasms. Generally, they happen in the evening when you're relaxing and you're sort of trying to calm down. Your muscles aren't doing that. And so delta THCA, which is a CBD, can help with those spasms. Guess what? I was having terrible spasms last year. I have, over the last 12 months, only had one spasm episode. And that was after I had done a tremendous amount of walking and moving around. And it was about 110 degrees outside. So a part of that I can blame on me not drinking enough water and just overdoing it that day. So water is a crucial element of also when you are using CBD, you need to drink a lot of water because our cells, guess what, are made up of 90% water. And for the CBD to really get inside the cell, to submerge and go in there, you need to have a lot of water in your body so that the CBD can work as it should. Also, another one, Delta-9 THC, reduces nausea and vomiting. A lot of the conditions that we get and some of the side effects of the drugs that are prescribed to different patients cause nausea and vomiting. If you're taking CBD, the THC in the entourage compounds, it will help reduce that. Now, I also mentioned earlier that there's different CBDs that you need to take. There's a full spectrum, and then there's isolates. Full spectrums, for those who are really looking at all of the different chemicals, contain THC. THC is one of the CBD chemical profiles, and it's the one that's getting all of the hoopla. It's the one that was deemed illegal. It's the one, that THC, where if it goes over a certain percentage, you have to have legal authorization. In the state of Nevada, it is legalized for either medical and or recreational use. But in CBD from hemp-derived products, such as from the HempWorks, which is here, in this type of bottle from HempWorks Company, the level of THC from hemp-derived is less than 0.03. And based on FDA guidelines, if it's under 0.03, which ours is under, it's considered zero. But then there's a form where you say it can be free. To be free, you have to have zero. That means it has to be isolated. So if you have a full spectrum products, CBD product, it has the entire chemical profile. It has all of the CBD and it has the THC, but in low levels. It's that entourage effect that many people need. Now, CBD still, without the THC, where it's isolated out, when it's zero THC, it can be called free. Okay, so the difference, you have zero and you have free. Zero is less than 0.03. And most of the time, I can't say 100% accuracy or guarantee because it depends on your body, how it metabolizes. But most of the time, less than 0.3 does not show up in any type of blood test. And that's what most people are concerned, especially if their employer is doing drug tests and they're looking for the THC. Now the 0 or has this 0.03, the free has 0, none. And that's why it gets confusing because people say, well, in the free, there's 0. Okay, the label is 0 is less than 0.03. Free means there is none at all. So if you want to get the benefits of CBD and you absolutely, definitely don't want to have any of the THC, then get the free. That is designated as free. We can't call it a whole spectrum because it's not. It is now as isolate because one of those chemical compounds has been pulled out. Now, I said your endocannabinoid system, it's in every cell of your body. So let's say you're having gut problems, the stomach. It can help that. Muscle, cramps, pain, circulation. It can benefit that. Skin problems, different neurosis, anxiety, fear, depression. It can benefit that. So you want to look at, okay, your cells are all over your body. You might have a certain condition that, I don't know because we're all different. CBD could possibly benefit all those things. For me personally, severe pain in my knee because I was in a grueling career. I taught dance for over 40 years. So you can just imagine the condition of not only my knees, but I've broken a toe, I fractured the bone in my foot. Currently, I have 3 herniated discs in my back. And it's not so much trying to cure or do anything with those things. No, that's not what I'm saying. It's the inflammation that's really causing pain. And so I went from taking 8 to 10 ibuprofen a day to 0 because I started taking CBD. So think about what's happening in your body. Are you suffering from a disease that has been diagnosed by a doctor and now you're on some type of medication? Is it a pain medication? Do you know we're having an opioid crisis in the country right now? And that opioid crisis is actually global. Did you know that taking all of those pain medications is bad for your body because of all of the side effects? If you're on a pain medication, why don't you try CBD? Why don't you see what a cannabinoid can do for your body because your receptors are what's causing the pain. It's those cells that you might need to focus on. So your endocannabinoid system, which is the gatekeeper of all of your systems, all of your organs, it is also controlling pain, inflammation, conditions that happen internally and externally. Your skin, your organs, your brain, everything that you do is connected to your endocannabinoid system. And so how great is it that there's a plant that naturally creates creates cannabinoids that naturally interact with your endocannabinoid system, that also benefits several different health conditions because it is naturally supporting and working with a system that is within your body already. Now, some of the latest news out in research through the medical organizations and research labs is that they have just semi-identified maybe that there's going to be a CB3. They don't want to release the information, but what they're doing is leaking a little information. They already know the valuable impact that the CB1 and 2 have, how it works with the body, how it interacts with some different plant substances. The original CB or cannabinoids are from the cannabis cannabinoids. You can see how the name is related genetically. And now they're even talking about that they've identified some cannabinoids in a humulus plant, which is actually the plant that they use in beer. So imagine the hops from beer, has cannabinoids in it. Now, is it as effective and strong, being what is called a generation down or separated by a generation from the original cannabinoid? That's yet to be seen. I personally want to go to the source. If cannabis and the hemp plant is the original source of cannabinoids, I'll stick with that. Yes, there might be generations down or other derivatives or forms of it, but why not stick with the original, as they say? So I recommend that you investigate more your endocannabinoid system. It might be the source of some of your conditions, your pain, anxiety. If you have questions that you want answered directly, I'm easy to reach. You can either post a question on our YouTube channel, which is CBD Talks, right there on YouTube. Guess what? You can go to Facebook and find me, Dr. Victoria Boyd, or you can go to Rock's Place and ask a question. Or you can go to our website, or my website, drvictoriaboyd.com, and ask a direct question. And in the future, I hope within the next 30 days, there's even going to be a website called cbd-talks.com, where you can find more information, more articles, more research, and soon we're going to have some additional products for you to use. Next time, we're going to be bringing on a pharmacist to talk about the pharmaceutical impact and the chemical reaction in the body of CBD. And then we're going to have a podiatrist on, and then another doctor. So I mean, literally out of the woodworks, the professionals are coming forward to give their impart the knowledge that they have on the value and impact CBD will have in the world. I am so happy to be the host, Dr. Dance, or Dr. Victoria Boyd of CBD Talks. If you have a question or even a topic you want me to talk about, please reach out. We're here for you. And so that's all for today. CBD Talks with Dr. Dance. See you next time.